In interest of time, I want to go ahead and get started, but thank you so much for your attendance. This is the Community Pharmacy New Revenue Roundtable. My name is Breck Rice. I'll be your host today. I've been working with community pharmacy now for over 20 years and absolutely love community pharmacy. I started with the old third-party solutions company back in the day. And if any of you have been around pharmacy for a while, you remember that. In fact, the PCN in your pharmacy system was TPS for third-party solutions. Great program. Every pharmacy used that until it went to the dark side. So it was acquired by a PBM, a big PBM. Most of you are aware of that and know that that PBM certainly doesn't have community pharmacy's best interests at heart. In fact, they do their very best to take as much of your revenue as they possibly can. And so when they got acquired, the TPS program got acquired, I was a director there. I left and didn't want to go to work for the PBMs and steal from my friends in pharmacy. So left the company, and we had the opportunity to start the new and improved third-party solutions, which is called ServeRx. So ServeRx is the program that helps community pharmacies get fair reimbursements on their workers' comp claims. And we'll from my team, we'll cover that here in just a minute. But first off, I wanted to welcome everybody for being here. We have some amazing information to share with you, and it's a lot of information, but please don't get overwhelmed. I make myself available to you to cover any one of the topics that you want to look at. And if you can just take one thing away from today and implement it, you're going to be better off for it. And so super excited to share with you what all these opportunities are. In my communications out to you, I promised you passive revenue that you could earn even in your sleep. We'll talk about that in just a minute. And then some fantastic collaboration that is happening for wellness right inside of your community pharmacies with wellness centers. So we'll look at that, as well as some fantastic products that you should be aware of. Again, it's a lot of information. We are recording it. I'll make the recording available to you. There's also a replay today at 6 p.m. Eastern Time. So we will be resharing the same information today at 6 p.m. So ServeRx, even though we sponsor this, we don't get anything from this. The vendors, whoops, sorry, this is really going fast. The vendors that that are here and present what they have to present, that's all because we love community pharmacy and we want to help you be successful. So first off, just to identify the problem and the reason why I even host these roundtables is basically this article from Fortune that came out right the tail end of the pandemic, talking about 1,231 independent owners just closing their doors for good, and how for the first time in 20 years we actually have dropped below the 20,000 mark as community pharmacy owners in the country. And big reason why is profit margins. The PBM's taking all the spread pricing and taking all the that margin out of dispensing medication. So back when I started in the industry, profit margins were 36%. That was fair. Today, they're now only 3 to 5%. In fact, there was a study that shows that 1/3 of medications dispensed from community pharmacy today is dispensed below your acquisition cost. So it's pretty hard to stay in business if you are paying more for the medication than you get reimbursed for it. That's just one problem. I don't need to tell all the pharmacy owners here today of what the problem with the DIR fees. So DIR fees, just to put that in perspective for someone that may not know what a direct indirect remuneration is it is increased by 91,500%. So that'd be the equivalent of a gallon of milk or even a gallon of gas costing you over $3,600. So absolutely ridiculous. And then we get the double whammy, right? Because DIR fees have caught up to the first quarter of this year, plus your backlog from last year. So this first quarter is going to be pretty hard to come up with those fees that are required in DIR, and very, very unfortunate. And so that was the whole premise behind, hey, what do we need to do to help our community pharmacies survive all this horrible downturn, and pharmacies that have been around for 80 years. This other one was for 106 years, that just ended up having to close their doors. I get updates from our PSAO partners all the time, and so we'll show you here just some of the most recent closures. You know, one that just closed 2 days ago, or actually they sold their files to Rite Aid, and then a bunch of other closures here that you can see, which is really, really unfortunate. I'm a firm believer that we need to make some adjustments and bring in more non-dispensing revenue into our community pharmacies. You know, the supermarket chains and the big merchandisers have figured that out, to not have all your eggs in that dispensing basket, but our community pharmacies, our independent pharmacies, still have over 90% of their revenue coming from dispensing. And so I think you need about 1/3 of that revenue to come from non-dispensing solutions. And so hopefully we have some of those solutions here for you today. When I was a little boy, I played Pee Wee League hockey, and you know, that's when your pads weighed more than the kid, so you're indestructible, and you could just run into the guardrails and run into each other and flop around, and you never got hurt. It was a really fun sport. But one of my heroes growing up was Wayne Gretzky, fantastic player, and this is a famous quote of his that when asked what made him such a great player, he said that he skates to where the puck is going to be, not where it has been. And that's really a good message for us in community pharmacy. We need to skate to where the puck is going. We can't just stay in the status quo, because the status quo is going to kill us. And so I love that quote from Mr. Gretzky. I'm going to show you a quick explainer video about our program. Turn some time over to Will. If you are not enrolled in this, you need to get enrolled. It's totally free, and it will help you get fair reimbursements.
An injured worker comes into your pharmacy. What do? Do they have a PBM card? Who is their carrier? Will I have to make a bunch of calls to find out? Will I get paid? And if I get paid, will it even cover the cost of the drugs? Don't worry, just send the claim to ServeRx. They will do all the work, guarantee payments, and you will even make more. Less work and more money. What do you have to lose? You are probably already contracted through your PSAO. All you need to do is enroll. www.serverx.com.
Excellent. Will?
Yes. Can everybody hear me?
Yes,
hear
sir.
me, Breck?
Yes,
Great
sir.
day. Great day, everybody. Like Breck said, no affiliations with the PBM. It's a great program that's available to everyone. There's a free service. My contact information is in the chat, so feel free to reach out. I can help you get set up. Easy process. ServerRx is a no hassle, no delay program. We're here to help pharmacies receive the fair reimbursements that you legally deserve. And how we do that is, for example, you can see right here, say a patient comes into your pharmacy, they would need a meloxicam for workers' comp. If you was to adjudicate that meloxicam through a PBM, your pharmacy may be reimbursed $3 to $4 for that medicine. Now that same medication, if you was to adjudicate through ServeRx's benefit PCN, we are seeing pharmacies being reimbursed anywhere from $101 to $105. and that will be reimbursed to your pharmacy if you are with a PSAO and 30 days through your central pay. And if you are an independent pharmacy, that will be reimbursed to your pharmacy in 45 days directly from ServRx. And how we give the pharmacy those higher reimbursements that you legally deserve is we reimburse the pharmacy AWP. So for brand medications, depending on your state or district, but mostly everybody's reimbursement for brand medications will be 85% plus a $2 dispense fee. Then for generic medications, we reimburse the pharmacy 70% plus a $2 dispense fee. We have a live help desk that's available 7 days a week. So if the pharmacy was to receive a rejection, you could give our help desk a call. They can help the pharmacy right then and there on the spot as well. Again, ServRx is a free service that's available to each and every one of pharmacies out there. So feel free to please reach out to us. We can help you get set up to start receiving those fair reimbursements.
Thank you, Will. Certainly appreciate it. If you haven't met Will before, he's fabulous. He's traveled the world, played with the Harlem Globetrotters for 12 years, and now we're just lucky to have him on our team here at ServRx. And you won't meet a nicer guy. So please reach out to him if you are not set up yet. Get set up. Still, about 1/3 of all workers' comp can be processed through us for the entire life of the claim because it's a self-insured employer. About 2/3 are going to get siphoned off eventually to the big, PBMs like Express Scripts and Optums and the CVS Caremark program, but still 1/3 of those we can process, and then we're the default first fill program for that first initial fill when the patient comes in and doesn't have any documentation. Then we're that default processor. You can use our bin and PCN. Let us do all the busy work of finding out if it's a compensable claim or not. But please reach out to Will. He'll take great care of you. Thank you, Will. Let's jump into a new technology that, if you haven't heard of this before, is absolutely amazing. I don't travel without it. I won't get on a plane without having my shield protection that you can get through GermsRx. So this one bottle right here actually replaces about 50 or 60 bottles of the alcohol-based hand sanitizer because it lasts. The FDA says it lasts 4 hours on your skin, which means it probably lasts 5 or 6 hours. And here to tell us more about these amazing products is my friend Scott.
Hey, Breck, as usually, the check's in the mail. You do such a good job of describing things, but more importantly, I just want to always say grateful to you for organizing this and really trying to help community pharmacies because they really are in a bad way. I talked to quite a few as well, and everything that you do is spot on. We appreciate it.
Thank you.
So what the heck is My Shield? That's the name of the product line. And we're basically taking new technology, new nanotechnology, super small stuff, and killing germs physically and not chemically anymore. It feels different. It comes out in like the hand sanitizer and the soap comes out in a super light foam. It dries very easily on your hands or legs. We have body sprays. We have all kinds of products that can take you from being in your house, going to work, being in your car, come home, and you're protected all the time. You don't have to be using it over and over and over. Like Breck was saying, one bottle lasts more than 60 or 70, and that's actually a low number. It sounds crazy, but it's probably over 100 bottles if you were trying to match time frames. But more importantly, it leaves your hands and your skin in good shape. And like Breck says, he takes one wipe and he does his two grandkids, little boys that get it in everything. And so he knows that they're protected for hours and hours and hours, unlike an alcohol-based product. As soon as the alcohol dries, it stops working. There's no residual germ-killing benefit to it. So we're able to put this in the pharmacies, and we're doing that now. And we got everything from wipes, and the topical antiseptic wound care is an amazing product as well. I'd be glad to talk to you about that. But these are really money makers in the pharmacy, and it's something to get behind. And we haven't had, to my knowledge, a product that you can promote in the pharmacy and be sure that it's going to work and benefit your patients and make money on it.
Thank you, Scott. You can meet Scott in the chat. His information on how to contact him is up in the chat. Amazing products that you should be carrying in your pharmacy, and profit margins are that around the high 40s, 50, low 50%.
Yeah, they're typically between 40 and 80%.
Oh, wow. Okay, excellent. So please reach out to Scott for more information. Have you all seen this new product, the Breath Rocks? Were you at NCPA in the fall? Because that's where this product was launched, and amazing product. Jonathan, the CEO, was kind enough to send me some samples that I used as stocking stuffers for Christmas, and the family absolutely loved it. So, in fact, I got to hit you up for more. My daughter's like, "Where do I get that?" Or you need to tell me what pharmacy here in Arizona is carrying this now. Jonathan.
Thank you, Breck. Yes, my home state of Arizona. We need to get some pharmacies there. We've got a great collection of pharmacies across the country so far, but Arizona we haven't gotten there yet. So what Breath Rocks is, it's a popping breath mint. So if you can imagine sugar-free Pop Rocks with zinc, that's what it is. And so what Pop Rocks does in this iteration of Breath Rocks, how it works is all of the zinc that's in there, it's actually neutralizing the gases in your mouth. Number two, that popping action is actually activating your saliva. And then all those little pieces that you're rubbing around your mouth because of all the great flavors and all the popping action is actually scrubbing your teeth. So this is a product that's not just fun and flavorful, but it's actually functional. So it's really the most functional breath mint on the market. And so it had been previously sold on HSN and QVC and Facebook. They did like $3 million in sales. We acquired the brand, we updated the branding, and we launched it through independent pharmacies. And so now this product, the wholesale price is $149. It retails for $299. So you've got that 100% markup, keystone margin. And like Breck said, we launched at NCPA, had a tremendous response. Our first 100,000 bottles that we ran, and right now we're in the process of running another 500,000 bottles. If you're going to be at the multi-location conference in Florida next week, we'll be there. And we've got probably 15 or 16 of our investors who are all pharmacists are going to be there. So it's going to be a great little reunion for the folks that are backing us. So if you want to order the product, please contact me. We self-distribute out of our Wisconsin facility, but soon you'll be able to get it through some of your secondary wholesalers. If you are interested in becoming a shareholder, we would love to have you. We're wrapping up our seed round funding here at the end of the month. At this point, we've raised over $600,000 from an awesome dream team of pharmacies. And we've also gotten a tremendous partnership, a sales and distribution partnership with an Austin-based convenience store trade association. So Breck, if you've got any family in Austin, we've got 100 and actually now it's 300 convenience stores in the Austin area. So over a third of all the convenience stores in Austin are carrying Breath Rock. So that's kind of our little pilot place, and we'll be going out from there. So this is a product that, yes, it's a fantastic breath mint, but I really think more importantly, these little bottles that cost you $1.49, they're a tool to grow your pharmacy. So if you're doing doctor detailing, don't bring them donuts. You're not Dunkin' Donuts. Bring them a product that you carry. Bring them a product that's fun and functional. And it also deals with some of the side effects of the scripts that they're writing with dry mouth, or you've got kids coming in for vaccinations, they're scared about needle. You give them some watermelon Breath Rocks. They're going to be focused on the part in their mouth. They're not going to notice you're jabbing them. And you give them the rest of that bottle, and that soccer mom is going to tell all of her girlfriends that little Johnny had an awesome experience at Village Pharmacy. And so this is a tool that we've had a lot of pharmacies that are seeing how it's powerful, and we've seen our pharmacies order a second and a third time just in the couple months we've been out. So grateful to be here. Thanks for Breck and the gang, and thanks for all the pharmacies that are backing us as investors and as retailers.
It's awesome. Thank you, Jonathan. And you can meet Jonathan in the chat. His contact information will be up there in the chat. Make sure that you get on his waiting list for the next round of distribution. So amazing product. Love it, and I'm glad that it's being successful. I'm glad you shared also, Jonathan, the tool for vaccinations. I mean, that's brilliant, right? Give the kid a little bit of candy that's actually functional and doing him well, and not full of a bunch of sugars. So excellent example of that. So thank you. Go meet Jonathan in the chat and make sure you get connected with him. I didn't see Devang. Is Devang here today? This is a program that's being built specifically for pharmacies called the Pharmacy Hub. When I went and looked at all of the digital marketing platforms that we subscribe to do our outreach, it's like 4 or 5 different platforms. And Devang's bringing them all into one platform, so it's just has everything in there from your website manager or builder. You can keep up with blog posts and everything like that. The digital marketing, so for social media ads and posts and everything like that. Email outreach, email campaign. I've been testing and piloting the email outreach function of this, and so fantastic service that is coming to our community pharmacies to help you not only market your pharmacy but do it more affordably, because like I said, it's 1 subscription instead of 5 subscriptions. I think we were up to 5 at one time that we were using here at ServRx. So I can get you in contact with him if you have any questions about that program. And then has John made it in yet? He wanted me to put him towards the end, the presentation. I don't know that I've seen John in the Casson. He logs in from all the way from the UK, so maybe he's still getting connected. We'll save MyRx Spark for just a minute until we get John here, and let me forward a little bit, get past some of his information, and we'll come back to it when he gets here. Oh, this next service is absolutely free for our pharmacies. It stays in line with marketing, right, and marketing your pharmacy. And this is a free business listing report. So why do you need that? There's more than just Google. People can find you on up to 60 different places on the internet. And this report goes in and makes sure that your information is correct, or that you actually even are listed on those other 59 places that you don't show up on, so that patients can find your pharmacy. So really cool, free service just to check that out. I will put a link in the chat here for you where you can find out more information about that. And there's a little explainer video for you too as well that goes into more details. So let me put that in the chat. I'll put it in there a couple of times so you can see it there. So those are the links that you can go and get more information about this free listing service, and then also fill out the form to have it done for your pharmacy. Some people have found that they had the right information of their pharmacy, but it was the wrong phone number, and so patients were not able to call the correct phone number. So that can all be corrected. So I'm gonna John is coming into the room now, but let's go ahead and cover Real Value RX next, and Jessica's here to tell us more about their program. They're fantastic. I know pharmacies that don't use them as a secondary; they use them as their primary because the pricing is so good. So Jessica,
hello,
welcome.
thank you, Breck, as always, and hello to everyone. And yes, as Breck mentioned, we're technically a secondary, but we do work with a lot of customers on a primary level, simply because our pricing, we try to keep our pricing extremely low. We don't operate on a typical rebate contract model. Everything is all about price transparency with us. So it's all direct net pricing. At the same time, you still get the benefit of flexible terms, extended terms, that kind of thing. Typically, what sets us aside from other wholesalers, I know there's so many options out there for the independents, but what's different about us is not only our regular retail maintenance meds very low in price without all the frills. But also we do have specialty items that adjudicate very favorably. So we're full line in both capacities. Typically, you'll have wholesalers that only focus on one or the other. We do both. And we tend to say that our pricing is aggressive on both sides. The items that adjudicate favorably, we try to always keep customers in the know, what's trending in their state, any coverage information. We also help give customers marketing flyers to help detail their doctors on new medications that might work well for them, things of that nature. So, aside from, wanting to work with you and just make a quick sale, we try to work with you on a more consultative level, just to kind of hopefully maybe bring that value to your pharmacy. And it's so important nowadays, as we all know. And then just some other tidbits about our company. We do ship for next day delivery. We do have long cutoffs. You can submit an order up until 7:30 p.m. Eastern for next day delivery. We do have Saturday delivery options. We have different order methods that you can choose from, whether you want to order with your rep, you want to just submit your orders via email. Maybe you just like to place your order online and not deal with a rep. That's totally fine. We also have EDI connectivity. So we try to be very easy and accommodating to our pharmacies. We know that they have a lot to deal with on the day-to-day as well. And then another tidbit is we are partnered with EasyScript. EasyScript is a benefit check software. It's kind of like a crystal ball for coverage. Really, really unique software that you can implement into your pharmacy. If anyone's ever interested in that and you'd like to learn more, I can always connect you with that team so you can set up a demo. Very informative. And again, it's something very unique that hasn't been done before. And it's just an extra tool that we offer you so that you guys can have access to those, highly adjudicating items. And that's pretty much it in a nutshell.
I'll cover one more thing. They help you with marketing. They provide these great marketing product profiles, and you can take these out to the doctors. This one is on pain management because that's 90% of what we do in workers' comp. So they'll help you market the right products that give you really good rates of reimbursement. So they'll help with that as well. So thank you, Jessica. Appreciate you being here. Mr. Casson is in the house, so welcome. Let me back up a few slides here and get to the beginning of John's presentation. So I'm sure John will go into a little more detail, but amazing technologist that he and his team are the folks who built WebMD. I think most of us have heard of that platform. And then, sold that off and then built other platforms that one that now has turned into Yahoo Money. And they're just really good at building programs. And I'm super excited about this program, the MyRx Spark, because this is the one I told you about where you can actually earn revenue even in your sleep. Mr. Casson.
Thank you. And Breck, just so everyone knows, I've used that statement of earn while you sleep all over the place now. It's actually becoming one of my sayings. So yeah, we built WebMD and we've looked at the pharmacy discount marketplace because it's problematic. 1 in 3 prescriptions issued by a doctor are not collected at the pharmacy. That hurts the doctor measured on medical adherence and health outcomes. It hurts the pharmacy because they don't put pills in a jar. The PBM doesn't make money and the patient doesn't get better. So we've created a platform that solves that. It's real-time pricing. The big competitor out there is GoodRx. We're 96 out of 100 drugs cheaper than GoodRx. So patients then can know that they're getting the best price. We've put the patient right in the center of their healthcare again, like we did with WebMD, and they can buy services and products very inexpensively on the system. We're talking to Breck. We want to try and assist in every way we can the community pharmacies. So what we've done is we've created a brand called MyRxSpark, and we've given every one of the 22,000 community pharmacies out there their own version of MyRxSpark, their own cards, their own posters, their own emails, their own QR codes. So they can go out and give their users, their patients, and everyone on their database the MyRxSpark card. You get the fill price that you've agreed with the PBM, plus you get a share of the revenue from anything of the pharmacy side that I make from the PBM, but also a share of the revenue every time your user buys a service or product. So think of this as levels. That's the first level, that's your existing users. Those posters and cards can now be put out in your community, at churches, at schools, at laundromats, at community centers, everywhere, driving traffic back into your pharmacy. Those users and that community also have friends, and those friends could be anywhere in the country, and they'll be using your version of MyRxSpark. So we estimate, without the friends of users, that you'll be pulling in a further $50,000 a year from these services. As I've said before, there's levels. We've been talking to several community pharmacies now who have signed up for the service, and the concept says that they would like more traffic. Well, that's our background. So we're going to create a very detailed, optimized web page for the pharmacies that sign up for MyRxSpark, and we will drive users who are searching on the internet, but also on any one of our websites, from Henry Schein or Lionsgate or any of the big partners who have many thousands of users, back into the community pharmacy. I've just seen a screen come up of Dr. Owl. Me and Breck are in discussions with Dr. Owl and other places where the law now has changed, where every EMR has to give a patient, if requested, a copy of their electronic medical record. Consolidating that into one place, the user has all of their medical records into one place, but more importantly, it's got all the drugs that the user takes. Now, wouldn't it be very cool to be able to pass that drug list with the patient's permission to the community pharmacy so they can look at drug interactions? There's lots of stats out there, and we will verify these stats. Breck and I are working on it now, but 67% of Americans do have a drug interaction problem, and it looks like 3% of people die from a drug interaction problem. So it's a very, very serious problem. But if we offer this free of charge to the patients, and we've got millions of patients on our platform from all our other providers, and drive it back into the community pharmacy, who is the expert at this drug interaction, can verify the pills and so forth. Should it be changed to this generic versus that generic? Should it be, you don't need this drug anymore? All of that stuff is also related to a CPT code that the pharmacy can earn from. So again, we're aiming to drive traffic, but also drive business back into the community pharmacies that work on the MyRxSpark platform.
Thank you, John. Amazing program. Let me ask a quick question. How many agents are out there marketing this program that now patients are going to be able to find our community pharmacies through?
So like we've done with, and it started with Breck and these 22,000 community pharmacies, the idea that we can give one community pharmacy their own version of MyRxSpark. We've just launched 4 weeks ago Real-Time Health Pass with 18,000 agents. We are now going live with 70,000 chiropractors, 3.5 million truckers, 600,000 veterans are all going to become agents that market to their users, their community, and the friends of those users. So in total, there are 7 million agents that could be touching 70 million users. So if only 1% of those agents get active and they only got 1,000 users, that's 70 million patients. And what we've called it, and sorry, Breck, I'm going to have to use my American, we've called it the Circle of Trust. That's not too bad from an English guy. But basically, it's a circle around our platform. So imagine all of these agents is like a family tree. Underneath the agents are users and community and friends. That's just a big family tree. A circle around it says we are going to only work within the circle. We want to drive users to the community pharmacy. We want to drive products that we can find to the community pharmacy in an integrated manner.
Yeah. Yeah. So let me recap real quick, because John is, and I'll use my my Northeast, my Boston accent. John is wicked smart. And so let me bring it down to my level. It's more than just a discount card. Okay. Most of our community pharmacies don't like the discount cards because it costs them money. This is literally at your cash price that you're dispensing, but then John splits that fee back with you that the PBM normally gets. The PBM usually gets a between $5 and $7 fee for a transaction fee. That's why it costs you money to dispense on, Good RX and some of these other discount cards. This one actually makes you money. Okay. But that's just one piece of it. Very, very small piece, in my opinion. The bigger piece here is our independent pharmacies really don't have an online way of selling. Their doors have to be open and a patient has to walk in to make a sell. Well, now John is giving you Amazon on steroids for pharmaceutical and DME and everything, but the prices are better than what the patient can find on Amazon. So every sell that's made, because you got that unique QR code, that markup from the wholesale to the retail comes back to your pharmacy. That's how you'll make 50 to 60,000 per year just being involved in the program, and it's passive. It's passive revenue that comes to you. He's providing you also with the landing page if you don't have a website. So he'll build you your own custom web page to direct people to, and that's the portal that the customer needs to get into to the online store. If your patient is on what's the medication you say that you can barely spell on a good day?
Lipitor.
Lipitor. If your patient is on Lipitor, then the system is going to give suggestions of other items that they may be interested in, glucose monitoring tools or test strips and different things like that, right?
Yeah.
Yeah. So amazing program. Are you going to tease them with you put the healthy trucker or whoever, they put in their zip code, they find the community pharmacy because they want to come in?
So again, Healthy Trucker has 3.5 million truckers that we're going to make agents. So you'll be starting seeing a Healthy Truck magnetic advertising banner on millions of trucks across the US, and that will have a QR code. All those truckers, 3.5 million, plus those users and friends of those users of that trucker all become part of our network.
Yeah, excellent.
And that what they then do when they go to the site where their zip code is and looking for the drug, we're going to be, for the people who have MyRx Spark on the webpage, we will be promoting them, highlighting them as a featured partner pharmacy, and also telling them that they're a preferred partner.
Yep. And by the way, the CPT code for billing on that drug interactions for the pharmacy is over $80. So John's going to be directing patients into your pharmacy just for that service entirely. So ramp up and get ready to have a lot of patients come in. I have spammed the chat with the explainer video on YouTube about MyRx Spark. I'm now putting in the link and the 3 steps on how to get enrolled. So doesn't cost you anything at all to get set up, and actually it's going to cost you about 50 to 60 grand if you don't get set up. So please follow those 3 steps and get enrolled right away on that program. Thank you, John. Appreciate it. I'm going to fast forward.
My pleasure. Here. Any questions? Let me know, guys.
Yeah, you can meet John in the chat. But obviously those 3 steps are how to actually just get started. So Cindy Gordon, are you here today?
I am.
Oh, great. I am so glad you're here. Cindy is such an awesome supporter to our community pharmacy partners. And not only do we bring new revenue solutions, we also want to help you cut some costs too. And that's why Cindy's here.
Absolutely. And as you're growing your revenues, you probably need more staff. And what's a key important factor to offer your staff is great health coverage. So I'm an independent health insurance agent. And what does that mean? It means that I'm not going to sell you Blue Cross Blue Shield all the time. I look at what is the best fit for small businesses, individuals, and families when it comes to their health coverage. There are so many unique products for health coverage that are out there. And it comes down to, as a business owner, wouldn't it be fantastic to be able to customize coverage to each of your employees' needs? We can do that because we have so many wonderful, innovative products. And what's cool about them is the premiums tend to be about 25 to 30% lower than traditional insurance models. So we're really looking to help people keep as much of their hard-earned dollars in their pockets and get the best value out of their health coverage. We're not used to getting value when it comes to health insurance coverage. We're just trained to pay our premiums and then pay co-pays and co-insurance and deductibles and keep paying and paying and paying while the insurance companies keep reaping the profits. And another piece that sort of sets us apart from other insurance agencies is that we become part of the small business team. We handle a lot of the administrative aspects when it comes to enrolling and terminating employees. We communicate directly with the employees to help them understand their coverage and, again, to get the most value, keep the out-of-pocket costs low. We have great relationships with companies that have incredibly affordable labs, diagnostic tests, and we even train people on how to get lower prices for prescriptions because they're used to paying $25 copay for a prescription that they think is going to be $800. They don't realize just self-pay prices, GoodRx, some of the other wonderful tools out there can really significantly lower their prices. So we have products we can work with anybody in any state. And yeah, we just love our partnership with Breck and helping community small businesses, community pharmacists keep going and keep getting stronger. So thank you for all that you do, Breck. Happy to be here.
Yeah, thank you, Cindy. Appreciate you supporting our community pharmacies. And please meet Cindy in the chat. You can certainly reach out to her contact information. Put it up there one more time. We've had a couple of people join a little bit late. Don't want them to miss your information. Next up is Brim Healthcare with Brim Wellness Centers. This is an amazing opportunity for our community pharmacies. It's bringing in wellness solutions or becoming a retail clinic, similarly to the Minute Clinic retail concept, but it's a Minute Clinic on steroids, and I'll tell you why. First off, just a study that was done by Will that says virtual care is going to surpass in-person visits. And let me tell you the reason why. It's not just convenience. We have a shortage of PCPs. There are fewer primary care providers today, and that number is shrinking. So it's not getting bigger, it's shrinking. And so that is an access problem. It takes patients months to be able to get in to see their doctor. And a lot of the areas that are suffering are rural communities. Well, a lot of our independently owned pharmacies serve rural communities. So with as little as 150 to 200 square feet, you can have a wellness clinic in a box. This is a part of the NCPA Team Up initiative because collectively, we are the largest healthcare collaboration in the US. Independent pharmacies is the largest chain. And collaboration allows you to still own the clinic. It's your clinic. But you have the support of a national network and program and a group that manages it for you. You don't even have to staff the clinic. They're going to staff it for you. They're going to staff it. They're going to take care of all the equipment and scheduling, everything for you. You just get to earn revenue off of that. It is a separate business unit. So even though it's inside your pharmacy and you own it, it's still a completely separate business unit. One of the amazing things that's already started with John Cassin's program is the National Employer Wellness Programs. We will be directing patients to your clinic for the wellness services. So not to a urgent care or to a hospital system or to a Concentra if it's a work-related injury. They'll be directed to your Brim Wellness Clinic. Okay, some of the things that are included in this, because it is an all-inclusive, clinic in a box solution. It's all the credentialing, licensing, patient management, practice management. They do the billing, collections, everything for you, and it's a national collaboration. The average ROI is about 3 months on that. Just to give you some idea, one client of mine that is one of our pilot sites that setting up, we'll actually do 2 sites with them, I believe. He did almost 10,000 flu shots last flu season, got reimbursed 167,000 for that because his average reimbursement was only about $17 for flu shot. Once credentialed, the same amount of work equates just under $1 million in revenue. Okay. So all of these services are what you can get paid for on the clinical side, or you actually just turn it over to your nurse that's running the clinic for you. And again, Brim hires and manages that nurse for you. And it only takes about 150 to 200 square feet to do that. So it's basically taking your consult room and turning it into a clinical room. This is an absolutely amazing program. One of the sites that's furthest along in their credentialing process is already generating $35,000 in new revenue. We believe at a fully functioning site should be generating $750 to $1 million in new revenue per year by having this Brim solution in your pharmacy. There are other clinical type programs out there. There's a Big Tree that I've seen getting some traction in the marketplace. That doesn't serve all patients. It's a subscription model, and people have to pay a monthly whether they use it or not. You're going to absolutely eliminate a huge portion of your patient population, especially your Medicare, your elderly, 65 and older. This program takes all insurances. You will be a full functioning clinic. They actually start with Medicare to take care of your 65 and older. Very first thing that you offer is a well care check. They all should be doing an annual well care, and they can do it right there at your clinic. And when you do that well care, you're going to find out really interesting things. You're going to find out that they have some chronic care needs, and so now that puts a whole program in place that is covered by chronic care management. There's you're going to find the opportunities like John talked about with the drug interactions through those wellness visits as well. So just a fantastic opportunity. There is a pharmacy fund that's being put in place. It's not set up yet. We're still waiting on the funds to come in to set that fund up, but it'll be a pharmacy fund to help our independents build these out. So it'd be like borrowing money from yourself and then paying yourself back. And then everyone will be a member of that fund. You're earning interest by being in that fund. So when you make your monthly payment back into the fund, you actually have equity in the fund. That then helps the next 3, 4, 5 locations get set up. And so it's a perpetual fund that just keeps growing and growing the more pharmacies that get set up and use it, and your equity continues to grow. So additional revenue stream that's even separate from your clinical services. There's a fantastic, amazing technology that's being brought in to these wellness centers. besides personalized medicine and approaches, looking at what the proper or correct medication that patient can metabolize is being used, getting patients off the medications that are doing more harm than good. There's the same thing being done for nutrition as well. So if you have, they're using a technology that uses artificial intelligence to identify the deficiencies in the patient that match with deficiencies that equate to a future disease state. Think about that for just a minute. This AI literally predicts disease before it becomes disease, okay? And puts that patient on a path to correct those deficiencies before it becomes disease. Amazing, amazing technology. One of the other technology that's being used is PEMF, pulsating electromagnetic energy, with a device called a bioelectromagnetic field that increases circulation and reduces inflammation. Inflammation, of course, is 93% of all diseases. Out of the 45,000 known diseases, 93% of those come from inflammation. And inflammation being reduced, getting your microcirculation improved, and getting more nutrient and oxygen to the cells keeps those cells healthy so they don't die off and create inflammation. I'm going to show you a quick little demo of what this does. So before I start that playing in real time, I want to pause it so I can explain what this is. This is a leg muscle that is blown up so that you can see one individual little arteriole bringing blood to the extremity, and a little capillary going off to the far left-hand side here. And then you've got the venule on the right-hand side that's taking the blood back to the heart and lungs. Also, this is also taking the metabolic waste back out of the system as well, too. So look how lethargic this is before treatment. So you'll see sometimes the blood doesn't even flow at all. It completely stops. But after only 3 minutes of stimulation, it's flowing naturally into all extremities. After 6 minutes, it's like the Autobahn. It's just flooding into. You'll also notice here, I'll pause, you'll notice on the right-hand side, these little white bubbles, those are white blood cells. It doesn't produce more white blood cells, it just makes them more active so they can police and do the job that they are intended to do. So again, even though it's not producing more white blood cells, it's making them more active. What it does produce more of is about 22% more ATP, cell energy, okay? So your vasomotion improves, or circulation improves by 30%, increase in ATP by 22%. Every patient should get a session every time that they come in because of all of the health benefits. I don't have anything chronic or anything at all myself personally, but I needed to be a product of the product. So I said, hey, let me try this system out. I did struggle with restless leg syndrome for about 20 years. I had it so bad that I actually wore holes in my fitted sheet on my bed because you're rubbing your feet together all the time trying to get comfortable. My wife would be like, "Are you trying to start a fire over there? I mean, stop wiggling around." And I had it bad. I inherited it from my mom. My mom always struggled with it. After about a week and a half, I did 2-a-day sessions, did one in the morning, one in the afternoon. A week and a half, I completely knocked out a syndrome that I had for 20 years. So RLS is completely gone. Don't have the restless leg syndrome any longer. Product works. It's amazing. 30 minutes after stimulation, so meaning that it lasts it's recorded up to about 18 hours in patients benefit. 2 dates that I want you to be aware of. You all probably know Dr. Lisa. Dr. Lisa Foss is a fan of our program. In fact, one of her pharmacies is going to be one of the pilot sites. But she has her Pharmacy Profit Summit coming up just around the corner, March 10th and 11th. So I want to make sure everybody's aware of that. If you're not registered to attend, you need to hurry and get that done. So great information there as well. She takes everything that we talk about in 1 hour and makes 2 days of it. But really focusing on what you can do at practicing at your highest level as a pharmacist. the wellness program, that BRIM program, is doing all that work for you, so you don't have to think, okay, how do I squeeze one more hour out of the day to do all these other things? They're going to actually do it for you. So that focus is more on the clinical side. What Dr. Lisa is focused on is more on what you can do to enhance on the pharmacy side. The other date I want to make you aware of is tomorrow. This event is there'll be 3 options to tune in for this, but tomorrow being the first one. And now that you're going to be making all this additional revenue from all the products and services that we've showed you today, we want to help you protect that revenue. And so this program here, we have I've lined up some amazing, fantastic professionals in this area, backed by a law firm, and by professionals who can help you double your profit, and reduce your taxes by a lot, 20 to 40%, and then maximize your retirement. There's things that you should be doing today. It's kind of like, the saying, when's the best time to plant a tree? Well, last year was, but if you didn't do it last year, then right now, plant the tree right now. This is the same thing. If you haven't started planning for retirement, get started today. And so we want to help with that as well. So this is a program that kicks off tomorrow, and look forward to seeing anyone that's interested in getting these benefits. I think actually have one of the pros here today, in Phil. Phil, would you want to just say hi real quick?
Sure. A lot of times people try to save money in a lot of different ways, but it's a good idea to look at everything that you do in a systematic way. If you don't have structure, you're going to go back later on, years later, and go, well, why didn't I do this? Why did I do what I'm doing? It's good for everybody just to make sure that they plan strategically so they can get the most outcome, and that's what we're going to show a little bit tomorrow.
All right, and Damar is a part of that. He'll be helping out with that tomorrow too. So if you do need to go, I understand. There is one other thing that I'd be happy to also share with you too, that we didn't get time to get to, but if you still have a few minutes, I would like to turn some time over to my friend Kent Nelson, who has an amazing program for generating revenue that is non-dispensing revenue. You need more cash payment solutions, and he has a whole functional wellness group of pharmacists that focus on this. So please stick around if you do have a few minutes, and turn some time over to Kent.
Thank you, Breck. So we need multiple streams of non-insurance income in our independent pharmacies. I had 4 at a PCCA, compounding, bioidenticals, etc. But my margins kept creeping. Years ago, 6, 7 years ago, I put in a nutritional program such that I wasn't losing down to Vitamin Shop and Walgreens down the street. So this is a pulse oximeter equivalent that measures lutein, zeaxanthin, astaxanthin, coenzyme Q10, beta carotene, etc. So with this technology, the test therapy test, and this is used at Stanford, Yale, across the United States, we're in 36 countries, multi-billion. So I am a key distributor. So this slide is what we do in pharmacy and medicine. We test, we provide a therapy, and we retest. So this is what I brought into my pharmacy that followed the protocol. It's not I don't sell it. I was born and raised in independent pharmacy, family pharmacy, Los Altos, Stanford, Bay Area. And if you can test it clinically, equivalent to a blood draw, that's really interests me. If you can change it in a month and you can retest, and the test is a light beam and there's no cost, and I rent it for $130 a month, and it has the full clinical background, I was able to develop my first year, 70,000 a profit utilizing this. Now, that was for the first of 10 years, and I grew that. I also took it to events, increased my customer count, was able to clinically develop a wellness program utilizing this technology. And that's what I teach, mentor, and train. Functionalwellnessnetwork.com is our website for education, because most pharmacists are scared to go from allopathic into any kind of wholeness, wellness area. And that's the future: epigenetics, nutrigenomics. So thank you, Breck. I love what you do. All of us independents need multiple streams of non-insurance income, creating better patient outcomes. That's my passion. So love to help anybody with a quick call to explain it. The website is Functional Wellness Network. Thanks for what you do, Breck.
Yeah, thank you. Appreciate you taking time, and everyone for spending a little extra time with us as well. We've gone over the hour, but I still have time for anyone that may have questions. I want to open it up and address any questions you might have. Bare minimum, get enrolled in the RX Spark program so you can start that process. We have patients ready to direct to your pharmacy, so let's make sure you're. And the one thing that wasn't mentioned, I don't think was clarified in that program, is this is not going to CVS, Walgreens. This is a community pharmacy program. This is just for our independently owned and small community pharmacy chains. And so take advantage of that, definitely. All right, any questions? All right, Damar.
Yes, Breck, this is, I just wanted to give a shout out to a fraternity brother who graduated from pharmacy school, Jeff Hill, who is, he's up in the Fresno area. So just shout out to him.
Awesome. Congratulations.
So, yeah, but great program today. Thank you, Breck.
Yeah, thank you. Thank you for being here. And you'll hear more from Damar tomorrow if you can tune in for that discussion on how to double your profit. Appreciate everybody being here today, and look forward to helping you any way we can. I absolutely love community pharmacy, and I'll do whatever I can to help you be successful. So please reach out to me, and love to help. Thanks, everyone. Take care. Have a great rest of your week.